Welcome to Asake Online. My name is Zenzele Ndebele. Today we are bringing you this program from the Thorn Hospital. I know in the past months and days, people have talked a lot about Thorn Hospital because this is where there is an isolation center where those who are suspected to have COVID are going to be isolated. So we are in this hospital today because a number of organizations decided to donate to Thorn Hospital items including food items as well as solar backup by Chloride Zimbabwe. Thorn Hospital is a place or is a hospital which was built in 1941. So this is quite a long time ago, and you realize that the infrastructure in this place is no longer in good shape, and like many other things in Zimbabwe, the place is now dilapidated. And because of the COVID-19, there is a lot of effort that is needed to rehabilitate this place, build proper infrastructure, paint the place so that when people are brought in here, they don't feel like they are being sent to die. So we are here at this facility to tour, to see the facilities that are there, to see where there is need for improvement. The mayor of Bulawayo, Solomon Mguni, and the town clerk actually took a tour around the place to familiarize themselves, to see the facilities that are there. I would like to say this is quite actually a good place that just needs to be maintained. This is a spacious place, a lot of space. The buildings are quite nice. What just is needed is maintenance. There is a bit of paint that is needed. There is need to improve ablution facilities, put additional beds, improve the laundry area. But I think this place could be nicer than Mpilo Hospital because there's a lot of space here. So we are appealing to corporates, individuals, anyone who thinks they can contribute something to Thorn Hospital so that Bulawayo is ready for COVID-19. One thing that I need to tell you is that this place is actually a referral hospital for 5 regions. That means anyone in Ndebele North, Ndebele South, Midlands, and Masvingo who has this disease or suspected to be having COVID-19 might end up at Thorn Hospital. So it is important that actually we take this time to refurbish this place to make sure that it is hospitable, because anyone, me or you, can end up in this hospital.
This is the isolation ward, specifically for highly infectious diseases like cholera, typhoid, and now the COVID-19. When the ambulances come in to bring patients, they use that double door that we are looking at. So that's where the ambulances drop off the patient goes in, and then the ambulance goes round. We're supposed to have a wash bay at the other end of the building where the ambulance is disinfected. Home clothes. They leave their home clothes there and then go and don for the patient to put on those, the space suits and everything in another separate room. And then they go into the patients. The patients are somewhere here. Yes. They go and attend to the patients. After they've been attended to the patient, there's supposed to be somebody who will be waiting to disinfect that person who will have attended to the patient. So they are disinfected. They remove everything that they will be putting on, including the scrub suit that they actually put on there. And then they remove everything and then put on a new scrub suit, a clean one. And then they go out back to the nurse station. So the challenge now is if it's raining, if it's at night, they still have to use the same route. They can't attend to the patient and then go back, otherwise they infect the whole area. They have to make sure that we don't infect the working area. We're supposed to have a clean area and a dirty area. So that's therefore the need for a veranda for staff to walk in when it's raining and at night.
Right, sister. What happens if when we say we now have patients admitted here and with high infectious disease like corona? Are these members of staff who attend to them during the day go back to their families, or for that period the person has to be confined to the hospital?
At the moment, they are going back to their families, but maybe Mrs. Ore can comment on that.
Yes, they are going back to their families, but we are hoping that we could have the staff accommodation which doctor was talking about. There are other rooms at the other side and even on the other side, which we are hoping they could be renovated so that staff who are on duty here, because they have to rotate every 6 hours. So we are hoping that if those rooms are renovated, the staff who are off could go to the rooms and rest there before their next shift and for the period when they are on duty, so that they don't go back to their homes during that period. But at the moment, the rooms haven't been renovated yet. I think that process is an urgent process we need.
Basic information on COVID-19. 1. How can one tell if they suspect it? The case definitions are based on the current information available and will be revised as soon as new information accumulates. 2. Suspect case. A. A patient with acute respiratory illness, fever, and at least one sign or symptom of respiratory disease. For example, cough, shortness of breath, and a history of travel to or residence in a country or area or territory reporting local transmission of COVID-19 disease during the 14 days prior to symptom onset. Or B, a patient with any acute respiratory illness and having been in contact with a confirmed or probable COVID-19 case in the last 14 days prior to onset of symptoms. Or C, a patient with severe acute respiratory infection, fever, at least one sign or symptom of respiratory disease. For example, cough, shortness of breath, and requiring hospitalization, and with no other etiology that fully explains the clinical presentation. Confirmed case, a person with laboratory confirmation of COVID-19 infection, irrespective of clinical signs and symptoms. The City of Bulawayo Health Service Department, HSD, requires your cooperation and assistance in ensuring that suspected cases are diagnosed early and necessary infection control measures and contact tracing are followed to prevent the spread of the disease.
Thorn Hospital is a municipal hospital. It was built in 1941 and it has been used, or we use it for catering for patients from the whole city. Currently, Thorn Hospital has got 3 main wards, and the 2 of those wards are active. I think the ward that we are sitting just next to, where we actually admit mainly patients with TB who are sputum negative, and the ward that is maybe on my left, that is where we admit patients who are sputum positive TB. We have an isolation ward, that is maybe the one that we visited a few minutes ago. That isolation ward, most of the time it is closed, but during the times when we've got epidemics, like when we have cholera, when we've got Ebola, and right now when we've got COVID-19, that is the time when we activate that ward and then start using it. The city of Bulawayo generally has been preparing to respond to this COVID epidemic. We've got various thematic committees, and the thematic committee on case management is the one whereby patients who are identified as having COVID are going to be admitted here at Thorn Hospital and in that isolation facility that has been identified. The symptoms involve coughing, having a dry cough, fever whereby your temperature is very high, sneezing, at times you may have a headache. So it started in China, I think that was at the end of December, and by the end of February, by the end of January, it had spread so much that the World Health Organization declared COVID a public health emergency of international concern. That meant all countries generally were supposed to start making preparations to identify cases, to be able to prevent any further spread if they identify cases, as well as to put other measures in place to be able to contain the spread of COVID-19. So as it is a new disease, I think it has never been seen before. Information concerning COVID has been changing over time. And the way in which information can be gathered is actually by studying the disease patterns among people who have got COVID and among communities where COVID has been seen to be spreading. And as we study these disease patterns, one of the key things that we look for is how the disease is transmitted. It has been noted that this COVID virus is actually a virus that is heavy. So if somebody coughs it out, the virus does not stay a long time suspended in the air. It actually goes onto the surfaces, whether it is the table, whether it is the floor, it is whatever surface that is there. So the problem that is there is when somebody actually touches that surface and then uses that surface, using those hands that are dirty, they now touch their face. When they touch their face, if they touch where it's called the mucous membranes, they touch their nose, they touch their mouth, or they touch their eyes. And if they touch these body parts with the hands that are contaminated, they get infected with this COVID-19. So the aim now to prevent infection is actually, the methods of preventing infection is actually based on the way in which it is transmitted. Because the surfaces can get contaminated, it is advised that you actually disinfect surfaces. And in areas where it is known that there are many COVID cases, like places like hospitals, we actually advise people working in hospitals to actually sanitize those areas. And it is known that the COVID is actually killed by concentrations of 70% alcohol. Not only do you sanitize the tables, we also sanitize other areas where most people touch, like in combis, in transportation vehicles, in areas, maybe in reception areas. When you go to where there are lifts, you actually have to sanitize. Where there are door handles, you have to sanitize those areas frequently. Now, coming to the hands, because using your hands, you touch all these surfaces, and almost invariably you are going to touch your face, whether 20 or 30 times a minute. You are likely to infect yourself. So we encourage people to wash their hands. You wash your hands with soap and water, and you have to wash your hands for at least 20 seconds to make sure that in the event that you might have had touched a contaminated surface, you actually get rid of that COVID that may be in your fingers. Then comes to the issue of masks. Generally, there are two main types of masks that we use. There are masks that are known as the N95 respirators, or an equivalent called the FFP2 respirators. Those are masks that are worn by healthcare workers when they are working in an area like a hospital or a clinic, where they are at risk of having somebody coughing and actually having those contaminated droplets coming in the area where they are breathing. So healthcare workers are the ones that are advised to wear the N95 or the FFP2 respirators when they are at work. Again, within hospital settings, if we have got a patient that we suspect to have COVID, or we know that they have COVID, those patients are advised to wear what we are called surgical masks. The surgical mask will prevent expulsion of air that has got COVID-19 into the atmosphere. So that surgical mask is not as good as the N95 mask, but it actually prevents expulsion of the COVID into the atmosphere and reduces the concentration of COVID in the area. It is important to note that after use of the mask, you have to actually take it off and dispose of it. In an area whereby there is no, like here where there's free-flowing air, there's natural ventilation, there is currently no evidence to suggest that there is COVID in the air, even if somebody coughs it out. Because if somebody were to cough it out, the evidence that they suggest that all the COVID particles will actually fall onto the ground. So there will be no direct need for people to wear any masks in public areas where there is actually free-flowing air.
As we heard of the COVID-19 and also the call by our government and also the call by our seat fathers in this kind of crisis, we shared across to our friends and partners, what can we do? How can we make a difference? How can we inspire our society? That we don't need, though we are told to sit in the house and lock yourself, We've been seated in the house, locked our house, locked ourselves, trying to have a better and enough grocery to survive with my family. But also the major concern is we have got our isolation hospital, which is this Thorn group, wherever someone can be identified with this challenge can be taken to. And it came to our minds as Tutuka Maten Trust, say, what can we do? How can we inspire our society, at least to give an eye? So therefore, some $1 came across, and we managed to organize with OKMAT to say, can we make us a simple and small grocer that we can present to our city father? And we know this is it's not much, we can say that, but it's a way of encouraging our society. Let's not just give a blind eye and say they will see themselves, they will see, because that is the mentality that people have, especially in our region. As I travel across this country, I've seen people, they stand up for a cause. They stand and give all what they can. But we are saying, Matabeleland people, let's also make a difference. And therefore today, the members of Tutuka Maten Trust and the friends that are there that make the organization made their contribution leaky by leaky, and we managed to raise this grocery before you, our worship. And we are saying whoever will be admitted in this place can be my neighbor, can be my relative, can be my friend, can be me as well. Is that so? Can be any one of us. And many times, also as a minister of religion, I do understand that sometimes when you do this is biblical. When you do, don't think of yourself, think of others. So in this case, we are saying to you, our seat father, we present this token of appreciation of your combined effort that we are seeing you doing in our society. And we say, Baba, we want to inspire our friends. We are hearing a lot of people saying want to make this and want to make this, but I think it's good to do than speaking, because many times the people, they speak a lot out there. But our approach as to attend is, let's do the leaky. Just take a 10 kg and hand it over and be faithful to the money that has been put across. So therefore, allow me to say on behalf of the Tutuka Matabeleland, our good friends, people out there, our friends, those that have come to be part of the organization, you have made this donation towards our Thorn Group Hospital for the benefit of those that will be at least admitted here.
With the COVID-19 disease that's been spreading all over worldwide, so we have decided to donate a solar system. So I came in yesterday just to do an assessment of what is needed, so that we have an idea of what we need to bring. So I spoke to Sister Lolo, and she gave me everything that I need to know. So I'm happy to inform you that we're going to do the wall backup system for the COVID-19 clinic. Thank you.
From the daily updates that I'm receiving and that we are receiving as policymakers, we are aware that as of yesterday, the city of Bulawayo did not have any cases of people who have been tested positive for the COVID-19 virus. We are grateful to God, because it can only be God who is sparing us. Otherwise, we could be another Italy. But the city of Bulawayo is being spared, and we are quite humbled, and we are grateful to the Almighty God for keeping us safe. I'm also aware of the tremendous work that is being done by the city of Bulawayo through the leadership of Town Clerk and your staff to ensure that we continue to prevent the transmission of COVID-19. It requires all of us to work as a team, and the city is grateful for the assistance we are receiving from various partners, including the Office of the Honorable Minister of State and corporate partners who continue to work around the clock to mobilize resources for us to be safe from this plague. I want to thank our residents and the community at large for heeding the presidential proclamation of a 21-day country lockdown to ensure that we prevent the contamination and treatment of the corona disease. The community of Bulawayo has been very responsive in ensuring that we minimize the movement and gatherings by staying at home. I commend you, the media, for spreading this gospel, because you have been very active even in these trying times to disseminate information. We cannot do without you in terms of the information dissemination, and we are very grateful. We want to commend you to continue to conscientize our people on the needs to prevent contamination, and especially to continue to wash our hands, 20 seconds, washing our hands with soap for those who cannot afford soap. So I think we need to improvise and continue to wash hands. But so we need to be united. This is not a time for blaming each other. It's not the time for name calling. We must continue to be united, cooperate with the authorities, cooperate with our youth personnel, and as well as be responsible citizens in our own right. This coronavirus knows no political affiliation, knows no tribal inclinations, and I wouldn't have to impost or Roma. So we need to continue to be united, protect each other, and love each other. I'm appreciative of today's donations, ladies and gentlemen, and thank all the donors and corporates who have invested in this worthy cause. And we know Bulawayo is a tanda, Bulawayo is our home. Let's continue loving it so that when all is said and done, Bulawayo kuthiwe azange isifo lesinjani sifike ko Bulawayo, just like we have not had effects of cholera and typhoid, which have affected other cities. Yes, but it's through the protection of God. This city is a city built on the foundations of Nkulunkulu. It's a prayerful city. So we hope that when all is said and done, Bulawayo is a sala unscathed by this plague. I also want to appreciate Zimbabwe for the donation which they've pledged a solar power backup. We appreciate such a donation. This UK-based organization. I know all over the world people are doing mobilization for resources. We'll inform you, journalists, the media houses, as soon as we receive these donations, because this is the time to be transparent. We need to be transparent and appreciate Labas Neta. I thank you.
My simple task is to thank all of you who have made this gathering for the purposes of the donations possible this afternoon. And my special thanks goes to the 3 organizations that have made some donations. Those being Tutuka Matebele Trust, as led by Mr. Takavimila Ngube and your colleagues say, and also Bulawayo Babies, which unfortunately is not represented here, and the Chloride Zimbabwe is represented by my sister Rudo, and also in absentia Rainbow group of hotels which have donated to us the linen for the hospitals. I would want to say to the donors, thank you very much for being the early group of donors who have come to the rescue of the situation. And this, to us, is very important because it will set a trend to those who are still deciding on what to do. And I know one thing for certain, once we have started, a lot of other donors would follow suit. Thank you very much for being the early birds.
So why don't we take this opportunity to actually spruce up this place, build nice homes, put nice beds, create a green environment where it's actually friendly for people who are not feeling well. I hope you will take your time to find out how you can assist the city of Bulawayo, the people of Zimbabwe, to make this place better. My name is Zenzele Ndebele. Till we meet again tomorrow. Have a good day.
Okuqhakathekileyo omele obekwazi mayelana ngomkhuhlane we-COVID-19. mpawu bani ezibangela ukuthi umuntu asolele ukuba lomkhuhlane we-COVID-19. Okwakhathesi imininingwane ekhona ngevela kungatsha ezempilakahle emhlabeni jikelele, kungakho ulwazi ngalo mkhuhlane luzaqhubeka lusandiswa ngendlela oluzabe lutholakala ngayo. Ngokusimo bani ocatshangelwa ukuba lomkhuhlane we-COVID-19? Isigulane esilesifo sokuphefumula nzima esifana lesifuba esivalekayo noma umvimbano owomisa umphimbo, kumbe ngumuntu oke wavakatshela elizweni noma isidolobho lapho kulabantu asebebanjwe belawo umkhuhlane we-COVID-19. Isigulane esiphefumula nzima njalo esike sasondelana lomuntu olomkhuhlane we-COVID-19. Isigulane esiphethwe luqhuqho kumbe ukukhwehlela lokuphefumula nzima esesidinga usizo lwesibhedlela. Ngonjani osoqinisekile ukuthi uselomkhuhlane we-COVID-19? Ngumuntu osehlolwe zingcitshi zempilakahle zisebenzisa imitshina eqondane lalokho kungakhathalekile isimo akiso. Ugatsha olukhangele ngezempilakahle kukhansili yedolobho lako Bulawayo ludinga usekelo lokusebenzisana ngokuqotho lezakhamizi zaleli dolobho kumizamo yalo yokulwisa lesi sifo. Ngakho kuqakathekile ukuthi nxa ukhona abasolakalayo kumbe abazisolela ukuthi balegcikwane le-coronavirus baxhumane labo ukuze kweneliseke kwenqabela kumemetheka komkhuhlane lo.